Questions 581 to 600. 581. Home healthcare department is newly established at a hospital. At launch, nurses asked the charge nurse about work at this department. Which of the following is the first step of home healthcare? A. Referral. B. Planning. C. Home visit. D. Assessment. The answer is A. Referral. 582. The nurse is assessing a child who has Tetralogy of Fallot. Observed that the child is having clubbing in his fingernails. Which of the following might be the reason for this clubbing? A. Prolonged tissue hypoxia. B. Delayed physical growth. C. Inactive bone marrow. D. Pulmonary fibrosis. The answer is A. Prolonged tissue hypoxia. 583. A 59-year-old woman is admitted in the medical ward for pyomyositis in her arms and legs. The muscular strength progressively decreased within 1 year. She has irregular breathing pattern and has difficulty in swallowing. Which of the following nursing diagnosis requires? A. Risk of choking due to disturbed swallowing. B. Weakness and fatigue due to lower muscle. C. Disturbed breathing due to chest muscle. D. Disturbed activities of daily living. The answer is A. Risk of choking due to disturbed swallowing. 584. Her of 9 children, 3 of them with congenital anomalies and 1 N syndrome. She is a primary school graduate, with low financial loss. She is not using any method of family planning. So the primary care nurse has referred her for counseling. Which of the following must be focused on by the community healthcare SC to provide an effective health education? A. Educate regardless realistic objectives. B. Use clear and concise language. C. Use scientific terms during explanation. D. Explain the negative consequences in the family. The answer is B. Use clear and concise language. 585. High school girl, who has fears of being obese thin, visited the primary healthcare center with her. The mother reports that her daughter refuses to with the family, and often pretends being asleep. Which of the following disorders best describe girl? A. Bulimia. B. Obesity. C. Substance abuse. D. Anorexia nervosa. The answer is D. Anorexia nervosa. 586. A 12-year-old child has been diagnosed with diabetes insipidus. Which of the following is disorder? A. Posterior pituitary. B. Adrenal medulla. C. Anterior pituitary. D. Adrenal cortex. The answer is A. Posterior pituitary. 587. The summer months, a 5-year-old girl presents with a sore throat and a dry cough that has slowly become worse over the past 3 weeks. Her body temperature is 38.00 C. On auscultation, there is wheezing and shortness of breath. She lives in an overcrowded house with 3 brothers, parents and grandparents in a low-income neighborhood where she attends school. Which is the greatest risk factor? A. Residing in a low-income neighborhood. B. Exposure to a pathogen in summer season. C. Attending school. D. Living in crowded conditions. The answer is D. Living in crowded conditions. 588. A patient returns to a clinic for a follow-up visit and is diagnosed as positive for Human Immunodeficiency Virus, HIV. The patient expresses fear related to lack of finances, fear of social avoidance, and hopelessness. Which of the following nursing action should? A. Referral to a physician infectious disease specialist. B. Referral to a community-based HIV clinic. C. Referral to the local public health department. D. Recommendation to disclose the diagnosis to family. The answer is B. Referral to a community-based HIV clinic. 589. While taking the history from a new patient, the nurse densified that he had hypomanic episode, which was alternating with a mirror depressive episode for the last 2 years. What is the most likely diagnosis? A. Bipolar I disorder. B. Bipolar IL disorder. C. Dysthymic disorder. D. Cyclothymic disorder. The answer is D. Cyclothymic disorder. 590. A 62-year-old woman admitted to the emergency department for the fourth time this year, each time the patient comes with sever injuries and bruises in the body. What is your responsibility as a nurse to prevent such incident to happen again? A. Reports the assault to the local police and write a report. B. Provides information about safe shelter and support. C. Instructs the women to move away from her home. D. Discharge the patient to a safe shelter. The answer is A. Reports the assault to the local police and write a report. 591. 5-year-old patient was brought to emergency room with several bruises on his body but showed fractured right forearm. He had no signs of pain while palpating them. He seemed scared and didn't answer any questions asked. Why should the nurse discuss this manager with the nurse? A. Care continuity. B. Abuse rollout. C. Support psychological. D. Management fracture. The answer is B. Abuse rollout. 592. A nurse calls together an interdisciplinary team with members from medicine, social service, the clergy, and nutritional services to care for a patient with a terminal illness. Which of the following types of care would the team most likely be providing? A. Palliative. B. Curative. C. Respite. D. Preventive. The answer is A. Palliative. 593. A nurse is assigned to care for a Muslim female emergency caesarean section. The patient asks the to wear a head scarf during the surgery. Which of the following is the most appropriate? A. Ask the patient to remove the scarf. B. Tell the patient that it is okay to wear the scarf. C. Ask the patient to wear a surgical cap. D. Tell the patient that a request will be during the surgery. The answer is C. Ask the patient to wear a surgical cap. 594. A nurse is trying to secure a peripheral V access in a traumatic patient who is deteriorating. The nurse has 2 failed attempts. What should the nurse do next? A. Activate code. B. Use interosseous needle. C. Consider arterial line. D. Call another nurse who is more experienced. The answer is D. Call another nurse who is more experienced. 595. A 70-year-old woman with a history of hypertension complains of lack of appetite due to bloating and constipation. The abdomen is distended and examination shows a positive fluid wave. Palpation of the abdomen confirms guarding and tenderness over the right upper quadrant. Lower leg edema 3+ and pitting bilaterally are also present. She is kilograms since her last appointment 3 weeks before. 164/92 mmHg blood pressure. 90/min heart rate. 26/min respiratory rate. 37.1 C temperature. 92% on room air. 4.5 oxygen saturation. What is the most likely underlying health problem? A. Hepatic congestion. B. Pulmonary hypertension. C. Left-sided ventricle failure. D. Splenomegaly. The answer is A. Hepatic congestion. 596. A 70-year-old man presents to the clinic with difficulty sleeping at night. He has not had a good night's rest for several months and feels exhausted. He needs to place 3 pillows behind his back in order to sleep. Examination of the lungs reveals crackles and wheeze. Auscultation of the heart confirms an S-gallop. Which of the following is the most likely underlying health problem? A. Asthma. B. Pulmonary stenosis. C. Right-sided heart failure. D. Left-sided heart failure. The answer is D. Left-sided heart failure. 597. During a CPR of an admitted patient in cardiac arrest, a family member tasks the unit nurse to be at the bedside and say final words to their loved one. The nurse explains to the family member that the scene is very disturbing and the medical team is doing its job. The family member still insists in witnessing the resuscitation efforts. What would be the most appropriate action by the unit nurse? A. Allow family member to be at bedside. B. Wait and ask permission from team leader. C. Call security to escort family member out. D. Refuse, because there is not enough space in the room. The answer is B. Wait and ask permission from team leader. 598. A 30-year-old woman was admitted with ectopic pregnancy on the 6th gestational week. The patient was scheduled for resection of the involved fallopian tube with end-to-end anastomosis, which is the initial nursing diagnosis for this patient. A. Grieving. B. Acute pain. C. Hyperthermia. D. Knowledge deficit. The answer is B. Acute pain. 599. What is the most appropriate blood product for a patient with hemorrhage due to upper GI bleeding? A. Plasma. B. Whole blood. C. Packed red cell. D. Serum albumin. The answer is C. Packed red cell. 600. A new community nurse in the rural clinics has to have good background about the health status of the community in order to assess their needs. What is the appropriate way to assess the health status of the community? A. Home visit. B. Community assembly. C. Mass information campaign. D. Community health assessments. The answer is A. Home visit.